And welcome back to Comcast Local Edition. I'm Steve Swat. And my guest this segment is Rick Keene, a member of the State Assembly from Chico. Thanks for being with us.
Glad to be here. Thank you.
You are one of the lead negotiators for the Assembly Republicans on health care. And since January, we've been talking on this program and throughout California about what do we do about health care insurance for all or some of the 6.5 million Californians who don't have health care, including 800,000 children. Where do you see this headed? We have so many disparate measures floating through the legislature right now.
Well, we've really got two fundamental problems. People have been talking a lot about the 6.5 million that are uninsured. A large segment of those are actually folks who can afford insurance that simply don't buy it. You've got a group of folks who just can't buy insurance because there's no access to it. Nobody will cover them. They need a large pool. Now I've got another group of folks who are not here legally, and there's a big quandary about what to do with that entire population period. And then you've got a small group of people who actually are entitled but just aren't signed up yet. So really, when you talk about solving the health care problem, you've got to look at those each individually. And then the other issue, which I think people are more concerned about, is the unaffordability of health care, which this does not fix. We've got an escalation in cost of about 11 to 15% per year. That means premiums double about every 5 to 6 years because it grows exponentially. And that, to me, is a bigger crisis, and that is what I'm really interested in seeing people try to get their arms around.
Well, let's talk about that then, and if we have time, we'll go back to this larger issue. With the premiums going up, one remedy, you believe, is to increase Medi-Cal reimbursement rates for doctors, healthcare providers?
That's right. One of the fundamental problems is that we're only reimbursing about 45 cents on the dollar for the cost of health care that we're providing for people on Medi-Cal. That means that cost is being shifted to people who have insurance, and their premiums are going out the roof because they're covering the folks who don't. So that totals up to close to $40 billion insufficiency in the healthcare system in California. And $40 billion is a lot of money, even from those of us from little rural towns. And the state has to step up to the plate if you're really going to solve this problem and actually start paying its own freight for the health care that it says it's providing for some of our citizens if you're ever going to get your arms around this problem.
Of course, if you go back several years, you see one budget year where the Medi-Cal reimbursement rates to healthcare providers will go up, and then maybe the next year it'll go down a little bit, and there seems to be very little stability.
There does, and there's really not any real accountability for the issue. I mean, if you're going to short the system, somebody's going to have to pay for it. So if somebody shows up to a doctor's office, which we've been talking about, or to a hospital and doesn't have insurance, that means the people who have insurance carry that cost. But if you also are only paying 50 cents on the dollar, and then they're showing up to the hospital, that means the other people are carrying the cost of it. So you really have to get your arms around the entire system if you want to get a solution. Going
back to the overall healthcare insurance problem, the governor's proposal would have businesses pay into the solution. The proposal by the Assembly Speaker and the Senate President Pro Tem would have business pay into it, even more than that. Do you have a problem with that?
Absolutely. The difficulty is that there are a lot of businesses in California, in fact, by our estimates, hundreds of thousands of businesses that don't make enough profit to afford to do that. That's one of the fundamental problems with the proposals that we have. So if you got a business that's making maybe 5% of payroll in profit, and you're going to say pay 4% of that in health insurance for your employees, then you're asking people to go out of business. They estimated under SB 2, which only required employers employing people more than 50 in their companies, we were going to lose 70,000 jobs with that alone. This goes down to 2 people, which means we're going to have hundreds of thousands of people potentially out of work, and with no work, insurance doesn't work either.
All right, well, we're out of time, but thanks for talking about this very important issue. We've been talking to Rick Keene, a member of the State Assembly from Chico. Thanks for being with us, and thanks to our viewers, of course, for watching Comcast Local Edition. I'm Steve Swat, and we'll see you next time.